Chapter 3, Video 1. Today we're going to talk about advanced wound care skills. There's several different things that you guys need to be aware of when we're talking about wounds. You need to be able to describe the wounds. You need to be able to perform the wound care. We need to know about wound prevention. So we're going to go through all of this in Chapter 3. There's different ways of describing wounds. First, we're going to talk about the open wounds. That is a break in the skin and possibly the underlying tissue, where a closed wound is a result of damage to tissues underneath the intact skin. So what we mean by that, you may have a pressure ulcer starting and it's underneath the skin, but you can't really see anything on top of the skin because that skin is intact. Intentional wounds are planned surgical or medical interventions such as surgical incisions, IV lines, and other medical devices that are inserted. And then we have unintentional wounds. This is a result of an accident. They may happen from a fall, a motor vehicle accident, gun or knife violence. These wounds, the edges are often jagged and they make it difficult to close the wound. And then you have to worry about as well the presence of microbes in these wounds. Acute wounds are, they're expected to heal completely within a few days or weeks. Often with acute wounds, these require sutures or staples. An example of an acute wound would be like the patient cuts themselves with a kitchen knife. So then if the patient cuts himself with a kitchen knife, we could say, okay, well, this is unintentional, it's open, and it's acute, because we do expect it to heal, but it did not happen intentionally, and it is open because the skin is broken. So instead of defining these terms, you're going to have to be able to apply these terms. So if you're given a scenario with a patient and they describe what happened, and what this wound is like, then you're going to have to go label it as intentional or unintentional, open or closed, acute or chronic. Chronic wounds often have a delay in healing. Sometimes these never heal. We see chronic wounds more often in people who have underlying medical conditions. And then we have three really common types of chronic wounds as well. That's your late stage pressure ulcers, your venous stasis ulcers, your arterial ulcers on the lower leg. So flipping through intentional and unintentional wounds. Again, let's go talk about the three common pressure ulcers. The three common pressure ulcers are going to be late stage, venous stasis, and arterial. These wound edges and these pressure ulcers cannot be closed with staples or sutures, okay? So they cannot be closed. These wounds can and tend to be chronic. With venous ulcers, the lower leg and usually the ankle area are affected because the valves in the legs are not sufficient and they're not returning blood like they should. So the blood pools and the plasma is forced out into the surrounding tissue, causing the swelling to happen, and then this in turn causes the skin to become fragile. And ways to prevent these problems is turning and repositioning the patient. And then we have the arterial ulcers. Feet and legs are usually affected. Diabetes, mellitus, hypertension increase the risk because they affect the arterial flow, and then also they are at risk for these to become infected. Again, prevention. We need to think prevention. We don't want the person to stay in the same position for very long times, so we need to turn and reposition this patient. We got to check their skin when you're in there caring for that patient. You need to always be performing skin inspections. You need to be letting the nurse or doctor know if you find breakdown. Make sure that we give good skin care and then anticipate their toileting needs. What do we mean by that? We went in, Miss Sudie has Alzheimer's. She went to the bathroom at 8 o'clock before we ate breakfast. I know that every day at 10, the CNA goes in and changes her. So we can expect every 2 hours that she's going to have some form of a bowel movement or some form of urinary incontinence. So we go in and we try to get her on a schedule because she has Alzheimer's. She can't remember that she needs to go. So we actually take her, say, come on, let's go. We're going to go to the bathroom. You sit her on the toilet and that triggers her mind to go ahead and use the bathroom. So we try to redirect and we try to manage their toileting needs in this manner. We need to make sure that we encourage exercise. We need to be using lifting devices when we're handling these patients. Good nutrition, good hydration, all of these are very, very important. A gunshot wound is intentional wound, closed wound, chronic wound, or unintentional wound. The correct answer in this one is going to be the unintentional wound because they're a result of an accident. You know, a person, they didn't intentionally shoot themselves, but it did happen. This is all for Chapter 3, Video 1. When we will return, we're going to talk about the different phases of wound healing. That will come in Chapter 2 video. That will come in Chapter 3, Video 2.